Oh, hello. Yes. Hi, everyone. Good evening. This is the monthly meeting of the Health, Seniors, Human Services, Youth Education, and Human Rights Committee meeting. My name is May, and I'm the chair of the committee. I'm going to be going over the agenda at first. But before I do that, I'm going to hand the meeting over to Larissa, hand it over to Larissa, and she will explain the procedures of the meeting.
Welcome everybody to the meeting this evening. I'm going to go over a few guidelines to make the meeting go smoothly. First, I would like to let you know that the meeting is being recorded. If you are not a member of the committee, we ask that you please sign in by using the chat box. You can enter your name and your affiliation if that's applicable in the chat box, please. During the course of the meeting, we would ask that you would please stay muted unless you are speaking. Our chair is going to take questions from the public after the board has had the opportunity to ask their questions. If you would like to speak, we ask that you please raise your hand. You can raise your hand by going down to the participants list at the bottom. Go to the bottom of your list and it will have a button that says raise hand. Press that. If you are joining us by phone, it is *9 to raise your hand, and we'll call on you in the order that your hands are raised. Other than that, you can also temporarily unmute yourself by pressing your space bar on your computer. If you're not speaking, please keep yourself muted, and you can unmute yourself on your computer screen on the lower left-hand side of the screen with the mute button. If there's any questions or you have any technical difficulty, please put a little message in your chat box and I'll come and try to help you straighten that out as soon as possible. Okay, thanks, May.
Okay, thank you. So we have quite a few agenda items in our meeting today. First, we will, approve the minutes. But the three main agenda items will be: number one, we will have a presentation from the Health and Hospitals Corporation Test and Trace Program. Well, they'll be talking about their efforts to stop the spread of COVID-19 and what we can do and what we should still be doing. Okay, the next agenda item will be a presentation from Department of Homeless Services. There is a proposed safe haven facility at 100 Orchard Street. And also so we'll be hearing from DHS and also the service provider who will be running that space. Okay, and then finally, we will be having a planning discussion about a parent resource fair that we would like to co-sponsor with CEC1, that's the Community Education Council, District 1. So that'll be more of a planning group session. So those are the three items I mentioned are the main substantive items of today's meeting. Okay, so we will start the meeting. Actually, before we start, are there any community announcements? Programs? Oh, could you not? Wait, you should, if you have a community announcement, you should raise your hand. I saw a hand raised. Brian Lewis.
Hi, everybody. Good evening. Brian Lewis from the Office of Manhattan Borough President Gail Brewer. Just really quickly wanted to remind everybody that community board applications are now available. They are due February 1st at 5 p.m. 2021. And I will drop a link in the chat. Thank you very much.
Okay, thank you. Grace Lee.
Hi, everyone. My name is Grace Lee. I'm a community member. I live down in the financial district. But I just wanted to give a quick announcement to people here who might be concerned. At 250 Water Street, Howard Hughes is trying to get approval to build two 470-foot mega towers on a historic landmark site that is zoned for 120 feet. And then although this is located in CB1, it is very close to CB3. And I wanted to make sure that community board members are aware that this could be an issue from an environmental standpoint and has an impact on certain areas of Community Board 3. Specifically, the noise and air pollution could impact Murray Bergstrom and also Smith houses. There is an opportunity for public comment of the draft scope of work for the environmental impact study. And I would really encourage members of the community to submit letters by this Monday, January 11th, with feedback on the draft scope of work to ensure that it takes into consideration the impacts that it could have on the community board, on the community in CB3. So if you would like information, I'm going to drop my email into the chat. And so, yeah, I'm going to drop my email in the chat, and please feel free to reach out to me. I can provide you with the links for all of the documentation, but I think it's really important that Community Board 3 also weighs in on this really, really important development. Thank you.
Okay, thank you. Okay, I do not see any hands raised. Is that correct? Yeah, I don't. Let me just look around here.
No, I don't see any other hands raised right now.
Okay, great. Okay, so we will start the meeting. The first thing that we will do is approve the minutes of the last meeting. Okay, all the committee members received the minutes of the last meeting. Does anyone have any changes to the minutes? If so, please speak up now. Oh, okay, I don't see anything, so the minutes are being approved, and now we will take attendance. Thomas?
Good evening, everyone. We're going to start off. May Lee,
Here.
Larissa,
Here.
David Crane. David?
He
He's on
was here.
mute.
See him, yeah.
He's muted.
I used
yeah.
the space bar and it didn't do it.
You have to
David,
hold it
here.
down.
Good to see
You
you.
have to hold it down while you're speaking.
Eric?
Good. So here.
Oh,
Yes, to the Grandmaster Walter Thomas.
Deborah?
Here.
Tatiana?
Yes, she. Oh,
I see you. Paul?
Here, yes.
Heidi?
Here.
Ricky?
Here.
And
Yeah.
Carmen?
Present.
Okay, thank you.
okay, thank you very much.
Shirley's here, Thomas. Oh,
That is
Thomas?
good. All right, Shirley.
yeah, hi, okay.
Okay, so do we have everyone? Okay, so let's get to the presentations. For the first item, we have Test and Trace Core. So that's Anna Schwartz, Laura Atlas, and Chelsea Cipriano. You need to, you're going to show a slideshow and start talking, right?
Yep. Good evening,
Okay.
everyone. Thank you so much for inviting us to the program tonight. We will try to keep it, succinct because I know you have an agenda. I am joined by my partners in public health from Department of Health. So my name is Laura Atlas. I'm the director of InterGov for New York City Test and Trace. I'm sure many of you folks have seen me on various types of briefing calls like these or at the borough board. So happy to continue bringing the roadshow around. And just so folks are aware, DOHMH is going to speak directly to vaccines, and I will stick directly to questions about testing and tracing, just so folks can prepare for that. All right, I'm gonna go ahead and share my screen, and we'll be able to go through the slideshow. So I will kick this off. This is normally the part that Department of Health delivers, but I can kick this off. So this is just a heat map from New York City. The long and short of it is that things are very concerning right now. As you can see on the left side, this is a heat map. All of this is available on the Department of Health website. the darker the color is on the map, the higher the positivity rate. So, folks can take a minute to sort of glance at that. And then we also have the epi curve of positivity on the right going up. The closer you get to the right, the more we are concurrent with the time that we are present. I just also want to make the note that the furthest out point where you start to see this dip, people get excited about that. That's just because the week hasn't finished yet. So, so that's a bit of an incomplete week. That's why you're seeing the numbers look like that. And then this is sort of another iteration of that. It's really important when you look at this to think about a couple of things. This map starts off or this graph starts off in May. You can see in April. What you can see right now is that we are roughly trending with where we were in April, which I think we all remember, how traumatic that time was, how difficult it was, how scary it was. I know it feels like we've learned a lot, and certainly we have, but there's still a lot more that we can all be practicing every day until we're sort of out of the wilderness here. The thing that I really like to point out on this is that it's not all bad news here. What you see in these dips, when the numbers sort of start to stabilize, is what happened immediately after we got through a holiday season. So you'll see we had a holiday season, the line spikes up. And then as soon as we clear the holiday, it begins to go down again. What that really shows us is that all of the things we're doing in terms of wearing masks, socially distancing, washing our hands, getting tested, and more importantly than anything else, avoiding indoor gatherings works. Every time we have a holiday season, which is synonymous with a large indoor gathering happening or medium-sized indoor gatherings happening, that's when our numbers immediately start to go sort of precipitously up. So again, you can see sort of in between Thanksgiving and Christmas and Hanukkah, there was a dip, then it goes back up at the end of the month, and then same thing with New Year's. So really want to drive that home with folks that avoiding small indoor, medium indoor, large indoor gatherings where people are taking their masks off is really key to this right now.
Laura, can I hop in
As
really
folks
fast? Just go back.
New York City Test and Trace has made it such that anybody who wants or needs a test can get one. Now, when I say this, I think people often think that means every block should have a testing site on it. Certainly there are blocks with testing sites on them. That's part of the design here. But, I also like to remind people of what it was like when we first sort of encountered coronavirus. The original criteria for who could be tested was extremely limited. As a reminder, you had to travel to a couple of countries. You had to have very specific symptoms. We are no longer in that place. Anybody who wants or needs a test at this point in New York City can access one. And so we do testing. There's a couple of different kinds of modalities that I'm going to talk about briefly. We have the sort of pop-up sites, which are the permanent sites that are connected to hospitals and the Gotham clinics. They perform what is called PCR tests. The PCR test is sort of the gold standard of testing in New York City. It's the most sensitive test that we can offer. And it's the test that takes about 24 to 36 hours to come back. Our processing times are getting shorter and shorter all the time, but I think we're pretty happy with a 24-hour turnaround for that. We also have sites that do rapid testing. All H&H sites that perform rapid tests also perform the PCR tests. And people ask why that is. It's because the rapid test is not as sensitive as the PCR. And I think this is how we get into a lot of trouble, especially around the holiday season. I'm sure a lot of people went to get a rapid test thinking they would get it, their result would come back, and they would decide if they were going to go to have a large dinner or, see people, see their grandparents. We all understand where that desire is coming from. But unfortunately, because the rapid test is less sensitive, a lot of people will find out that they test negative on the rapid and then positive on the PCR. So really want to caution people before they use a rapid test to sort of make decisions about what they're going to be doing. Additionally, we have the mobile unit. There's one in Chinatown right now. The same thing, PCR test. The advantage is that we can move them all around. And we have the self-swab sites. The self-swab sites are a really unique modality. They can set up basically anywhere. We've been in houses of worships and elected offices and district offices. And same thing, it's a PCR test. It's a very simple process. They also move all over the city. But what we're really trying to show you is that, we are being as creative as we can be about how to encourage testing. I think the great news for us is that people are taking testing really seriously. We usually see a huge surge in testing right before holidays, but we're continuing to see that surge even after the holidays now. And so that's great news for us. We have more testing capacity than we've ever had in New York City, and we want to make sure that folks have access to it. On that note, this is usually where I switch over to Department of Health. Chelsea, were you able to get on or unmute yourself? I know you were having some trouble. Yeah, but you're a little far away.
Okay, how about now?
Yeah, that's better.
Okay.
All right. So I am gonna leave us with one little piece of food for thought, and then I will hand it to you. So as a reminder, anyone who tests positive or has questions about COVID and feels like they need more immediate answers than they're getting, they can always call 212 COVID-19. That's kind of your wraparound, one-stop shopping for COVID services. Also would remind folks, the most important thing when people test positive is to isolate immediately. So we understand that New Yorkers don't always live in situations where isolation is, feasible or easily feasible, which is why we offer free hotels. So if anybody who identifies that they are not able to isolate, we will come pick you up, take you to the hotel. The hotel has full services, including food delivery, on-site medical care, mental health care. And then at the end of your stay, we will drop you back at home. So nobody's sort of stranded trying to figure out how to get home. The idea is that we want people to come into the hotel system so that they can isolate and we can break the chain of transmission. On that note, Chelsea, let's hear about vaccines.
Sure, happy to do so. I think the slide that was just shown before was, I think, a really salient message, and the data shown at the beginning of the deck, Laura, is a really important frame for this. We are so excited about the promise of a vaccine and about this very bright light at the end of a very, very dark tunnel of a long year so far, or last year, moving into this year. I think the reminder at the beginning of the deck isn't meant to be, a total downer, but it really is a somber reminder that the data translates to people that we love, people that we work with, people that we live with, and the lives being impacted by this virus still today. And the vaccine being available today doesn't stop the hospitalizations that we're seeing right now. And so what does is those things that we know work, getting tested and keeping up with the core 4, those work now. So we really need folks to double down and remain vigilant right now at this moment in time. That being said, I am happy to be here to talk about the vaccine. I know we've been getting a lot of questions and folks, yes, just lots of questions, which is totally understandable. Our goal is to provide accurate and transparent information and in multiple languages. And, as we get further into this, in multiple voices and messengers that resonate with the community. We have a lot of work to do, but it is our goal and commitment that New York City's vaccine be turned into a vaccination and is safe, free, and easy. I'm sitting here in the Vaccine Command Center now, which is an interagency effort, and which is we're really trying to do everything we can to ensure equitable distribution and clear and transparent communication about the vaccine. So we're here. This graphic that you see on the computer on the screen right now is available in our social media kit, which we're happy to share. We have tweets and graphics ready to go for folks who need them. Next slide. This is just a little bit about the Vaccine Command Center. We don't have to hover here very long. I think I just went through it. This is what we're doing here at the VCC. This is about who will be offered vaccine first. This is changing every day. So really we're trying to keep the information updated. The phased distribution of vaccine in New York City is being driven and set. The strategy is being set by the state. So we await their guidance on additional eligibility categories. The governor just announced some additional detail about phase 1B. The best source for the city's information on this is nyc.gov/V as in Victor, C as in cat, C as in cat, the VCC, or nyc.gov/COVID vaccine. So this is essentially, while there's limited supply of vaccine, distribution is being phased based on risk categories. And those categories, like I said, are being set by the federal government and then implemented at the state level. We're scaling up distribution sites. So we're ensuring equitable access, and we have all of those locations listed on our website at nyc.gov/vaccine locations. And I'll put all of this in the chat as we get into questions. I guess backing up just a little bit, I realized I didn't do a good explanation at the beginning about the vaccine. The vaccine, there are 2 vaccines currently that have received FDA emergency use authorization at this point. Those are Moderna and Pfizer. You may have heard about these. They're both mRNA vaccines. And what that means is that they do not contain the virus. You cannot get COVID-19 from the vaccines. And they don't interact with your DNA. Basically, they teach our cells how to trigger an immune response and build immunity to the virus that causes COVID-19. Our bodies then get rid of the mRNA as soon as it's finished using it, kind of like instructions that come into an email, and then the email is like auto-deleted once you're done using the instructions. Both vaccines have been shown to be more than 94% effective at protecting the clinical trial participants who participated in those trials from getting COVID-19. And specifically because we do get questions about this, the Pfizer vaccine is available for people who are over 16 years old or 16 and above, and the Moderna vaccine is only for people who are 18 and older. So research is ongoing for the pediatric populations. We've been getting a lot of questions about kids, so just want to address that head on. And so it may be available to younger New Yorkers in the future, but right now this is so important for adults to get vaccinated, so we can help protect those who can't. I won't get much more into distribution. I can answer questions, but essentially this question about when will vaccine be available, the answer of wide availability probably until mid-2021. And of course, everything I'm saying is caveated with, at this point in time, this is what we know. Could change tomorrow, as with everything with COVID-19. This is why it's so important that we keep doing what we're doing and know what works, right? We know the core 4 and getting tested and taking these precautions can help prevent the spread, and we need to keep doing that right now. Next slide. This is a little bit about where. So we are setting up additional vaccination sites using our everything, from T2 partner testing sites and other settings around the city. But this is also, happening in your healthcare providers' offices, clinics, pharmacies, urgent cares. The expectation should be set that it's not just about these city pop-up, or I won't call them pop-up, but hubs. This is really going to be utilizing the existing infrastructure where we all get our vaccines already. So this website, you can go here and get to the locator, or go to nyc.gov/vaccine locations, as I said before. Next. So we keep getting this question, of course, which is a great one, of like, what can I do right now? And I think everyone is really anxious, and for those not in eligibility categories or eligible categories right now who aren't, healthcare workers or patient serving providers or long-term care facility residents or others, it's a great question. And there are things we can do. We can, obviously, I won't say it again, get tested, practice core 4, but getting accurate, reliable trusted information out there is so important right now. We acknowledge there's a ton of misinformation out there about vaccines generally. There's a lot of mistrust because of, a long history in this country of racism in medicine and a lot of continued biases experienced by people of color in the healthcare system. And so we are working with trusted community partners, with community leaders like you all, and the communities you serve to ensure that people have accurate information. We have our social media kit, and we really want to help people get the word out if they do get vaccinated, when they do get vaccinated, using these hashtags. And of course, our Speakers Bureau, which we are always happy to do town halls or other events to ensure that we're getting the word out there and getting people the information that they need. I think that's it. It was really fast. I covered a lot, but I'm happy to take questions.
Okay, thank you very much. I see a couple of hands raised, 3 hands raised with questions. So it will be
Susan can't raise her hand. She does have a question as well.
Yeah, I see. Actually, she did raise her hand.
Oh, she did.
Yeah. Okay. I see. Okay, so it's Michelle, Susan, Trevor, and then Deborah. Michelle Cooper.
Thanks,
Smith.
May. Thanks, May. Thank you both for being here to present on this, but I have a couple of things. We have one of the highest rates of COVID positivity in the entire borough, and yet we have no COVID Express locations where people can get rapid PCR tests. I had to go to Fort Greene to do that. Moreover, making a COVID Express appointment is extremely difficult for people in our district who have limited connectivity. You have to log on literally at midnight and refresh the page in order to get an appointment. I strongly encourage you to consider opening a COVID Express location that has people with multiple language capabilities, does not require you to make appointments online, that people can access. It's critical. It's really critical. We have a very diverse district with diverse income, people who have to go to work. We need one of these COVID Express sites. The other thing is that there are multiple websites about where you can find out about COVID testing locations. I counted 3 at least, and they're spread across Test and Trace and the NYC Department of Health. It would be highly recommended that you consolidate all that information so that it's in one place. I do not understand why I have to do that. I have to look at 3 different places. Some have all locations, some have only COVID Express locations, and some only have health and hospitals locations. Why can't that all just be one website? nyc.gov/COVID test. That's it. One site. I went down to LaGuardia houses where there's supposed to be a mobile unit over the weekend, and it was not there. At 236 Clinton Street, it was not there. And I have also been tested at a mobile site where it took 4 days for the results to come back. That's useless for 4 days. It needs to be less than that. I went to Gouverneur earlier this year, and it was in less than 24 hours. That should be the gold standard. And then on the vaccine situation, I saw that Cuomo and de Blasio's press hacks were arguing on Twitter today about rollout. So I don't really believe that you all are working well with our state partners. It's a disaster. I watched both of their press conferences. It's a disaster. I don't understand why this hasn't been worked out. You've known that there's going to be a vaccine for 10 months. And then moreover, I have an 87-year-old grandmother who lives in Rego Park, and I have no idea how she can get vaccinated. I've seen Dr. Choksi say, call your primary care physician, but the primary care physicians can't even get vaccinated. You don't have a way to sign people up. I mean, I saw New Mexico has an ability for people to sign up. Why doesn't New York, the epicenter of this, have a way for people to sign up so they can be notified? I mean, and I have a friend who's a medical ethicist at Cornell who's going to get vaccinated before my grandmother, who's 87 and has high blood pressure. So I know that you have lots of platitudes and nice things in your PowerPoint, but it's a mess. And I really hope that you guys can work on this, and I'm happy to provide more information. I've sent this to Susan already, so thank you.
All right, I think there's a lot to unpack here. I'm going to start, and then I'll hand it to Chelsea. I want to say specifically on the Express Quickie Labs, these are DOHMH clinics that were previously used for STD testing. We sort of have converted them into COVID testing because that is the most pressing need right now. So they operate on a little bit of a different system than the rest of the COVID testing that T2 is doing. So we'll pull that out and put it aside. the mobile units that we have. And if there's a mobile unit that you go to and it's listed on the website and you don't see it, you can send an email to us that it should be there. I'm sorry if it wasn't there. Sometimes, you know, they may have trouble parking and they may go around the corner and folks think they're not there. Understood that this can be very confusing. We want to do the best we can. Like, our goal is to get everyone tested whenever they want to get tested. So if you see that there's a site that, you know, is not exactly where it was listed as, let us know and we will fix that. The mobile trucks, we're starting to roll them out as rapid testing trucks. So for folks who are looking for more rapid testing, and I want to just go back a little bit though to what I said in the presentation, which is that while while rapid might be what people prefer because they want to make decisions based on what that test says, it is not the gold standard of sort of producing results. It is not as sensitive as the PCR. The PCR is the gold standard. I'm not sure where you got tested that had the long turnaround time. And so we can look into that. I don't know if it was at an H&H site. If it was, happy to look into it. We are now.
It was a mobile H&H site that had PCR tests and it took 4 days to get the results back.
You can look into that. I mean, there's also, I know that there are times where the truck will post the results, but it won't necessarily send an email notification. So they're in the portal, but they're not necessarily an email notification. I don't know. I'm just telling you what can happen. So understood, and you can reach out to us if there's a delay. At this point, you know, we're hearing mostly that folks are getting their results back in 24 to 36 hours. I think that's the part on testing. I think that's my conclusion. Chelsea, do you want to hop in here?
Hey, yes, I can, sorry, I can speak a little bit about, sorry, visitor. So I did hear the question about how people can get help making appointments, I think, and what you were asking. And we are working to set up an assistance for people who, we know that not everyone lives online in today's day and age, and people will need assistance making those appointments when they become eligible. It is going to be available, I believe, next week. That's not being set up by my department, but I am sitting here and trying to get the latest information for you. So that is what I know about that. I hear you, and I'm taking in all of your feedback and comments. We are doing our best. We are working around the clock right now to ensure that folks have access. So if people need things, or you want to ask us or give us feedback on what we're doing and how we're talking about it, I'm happy to take it.
All right, also on the appointments point, let me just say that no H&H facilities take appointments. They are all walk-up only.
Okay, is that it? Okay. Okay, so next is Susan. Susan?
Yeah, I had unmute. Thank you. For the vaccines, how do we know when it's okay for us to make an appointment? How do we get authorization? And how, you know, we know about all the sites out there, but we don't know what do we need to get a vaccine?
Sure, yes. So, so the details on what you actually need to, when you arrive, are laid out in state guidance. I can only speak for 1A right now. But I hear the question though of bringing proof of employment, which is basically how what phase 1A is tied to. But when it's time to make an appointment in the next phases, you will have a call line and an online appointment system that essentially enables you to enter in information and attest that you're eligible, and then you can go get vaccinated.
So we just call basically when we think we're eligible, we just call the number and can verify that.
Yes, and that's what we are. We're the I know that folks are very, I don't want to put all the onus on New Yorkers to know, right? To know all of this themselves and keep it in their heads. So we are working to make it clear for New Yorkers on our site and through the text. If you aren't signed up for text COVID to 692-692. Those are like the alerts from the city about COVID-19. We're going to try to push this out and push out information in as many ways as possible, including on the ground through our outreach teams and through calls to people's homes.
Thank you.
Thank you.
Okay, next we have Trevor, and after that, Deborah.
Hi, May. If you could cue me behind your committee members, I'm okay with that, and perhaps my question will be answered. So just cue me behind all of your committee members.
Okay, well, then put your hand back up if it's.
Okay.
So Trevor, just raise your hand. Now you'll drop to the bottom of the list. I
That's
lowered
fine.
your hand.
Okay,
Yeah.
okay, next is Deborah and then Ricky.
Hi, thank you. So I have a question that's specific to a category of workers. I know that you mentioned in your presentation that it changes every day. What I'm curious about is where right now it stands for educators. And I know that the first group of essential workers expecting to happen like now and in February, and then the next group of all other essential workers would be likely March, April. I know that the teachers unions, and I know that the New York State Association of Independent Schools and other education groups are sort of lobbying to try to figure out where in these two next rollouts educators fall. Do you have any information to provide about that? Thank you.
Oops, I was just on mute. Sure. So I can't speak to the timelines that you just laid out. Those are not, unfortunately, in our control here at the city level. So I don't want to make any false promises that I can't keep. But phase 1B, which will be, I don't have the timing exactly, but I do know the governor announced today that the phase 1B will include, I believe he said, adults 75 plus. It does include teachers and education workers, first responders, and public safety and transit workers. I believe that was the announcement, and then additional frontline essential workers who have trouble physically distancing. So I don't have the exact timing on that, but that was, I believe, just released today. Maybe, I mean, it was definitely before I made this PowerPoint deck. Sorry, or just after, but that should be updated on our website very soon if it's not up there already.
Great, thank you, I appreciate it.
Yeah, I actually, I will, I can't multitask this. I'll do it as the person's asking the next question. I'll share a document that outlines the phases as we currently know them.
Yep, much appreciated, thank you.
Thank you for the question.
Okay, so next will be Ricky and then David.
Hi, Chelsea. Hi, Laura. Long time no see. Hope everybody's well. I actually had a technical question. I'm curious about the PCR being the gold standard as far as the testing is concerned. I understand that the PCR tests in general, not just for COVID, is that it generally tests for the presence of the virus or bacteria when it's used for testing, but it can't tell you whether or not the bacteria or virus is actually alive and potentially making somebody sick.
So the PCR, I mean, like we said, it's the most sensitive test. One of the reasons that we don't currently recommend that people who tested positive get retested within 90 days is because the PCR may return a positive again, even though the virus is no longer active. So we are aware of that. But again, I think, we would rather be overly cautious than undercautious, whereas the antigen test may miss infections that are in fact still there.
Okay, great. Good to see you guys all. Full disclosure, I used to work with Chelsea, so everybody be nice to her.
Okay, next is David and then Paul.
The governor has recently said that that Javits Center and SUNY, I believe SUNY and CUNY sites are going to be set up as vaccine distribution sites. Are you plugged into that effort?
Are we plugged into the effort of the state's distribution sites? I think
yes, in light of the evident lack of communication that seems to be happening. Yeah, so are you plugged in?
I think
aware?
we are aware. We are aware that they are happening, and I think that we really do. I can't speak to what's happening in the press right now, obviously, but we are working with the state to ensure that they understand the needs of the city, and we have been asking them, for the guidance, and we do work with the state. I know that there's a lot happening right now, but I'm not just saying that.
Okay.
Okay, Paul and then Thomas.
Thank you. Just wanted to ask, you said the rapid test isn't as effective in seeing a result. What can you backtrack that for me?
Not as sensitive. It's not about effective so much as what it's picking up in the lab. So the rapid test is, and there's a one pager actually that Chelsea, did you just drop it in?
Yep.
So if you click the one pager that Chelsea just dropped in, it actually goes through the difference between the functions. So the PCR is what we call a molecular test. It's actually testing the genetic material of the virus, whereas the antigen test is just looking for proteins. So the PCR is just a more specific way of, like, think about it as a magnifying glass versus eyeglasses.
Copy. So that being said, why even offer the rapid test if it's not as sensitive?
But
Just
like I
pretty
said,
much throwing it under the bus. So
as I didn't throw it, no, I wouldn't say that. And I would say that by and large, the rapid test will probably pick up on an infection. It just may not be as sensitive. And again, the PCR at times may be more sensitive, right? Because you may pick up on an infection that has already cleared up, but you still have remnants of the virus in your body. So I just want to put that as on two separate ends. Now, what I would say is that there is a vast appetite for rapid testing. There are places that only offer rapid testing. At New York City Health and Hospitals, when you receive a rapid test, you also get a PCR test. And if you test negative, we automatically run the PCR test.
Okay. Thomas and then Trevor.
Good evening. I'm coming from the perspective of the Department of Education. I myself am a school teacher. Thankfully, we have been having weekly testing at the schools. A concern by many of my staff is, we're testing a random 20%, but prior to our return from the recent holiday break, any staff member who had wanted to be tested and was on the list was able to be tested. I myself was tested because we had a student who was positive, and I just wanted to assure that, I could just maintain the integrity of my own household. So there were some concerns that as of right now, only the 20% would be tested. And, unfortunately, we're having a lot of staff members almost daily in many sites testing positive. So, though the stats say one thing, I'm seeing on the ground in real time that there's a lot more people who are testing positive. So I just want to know, I'm not sure how integrated you are with those policies, but do you know what's the reasoning for that?
Yeah, so I can speak a little bit to it, although, this is a collaboration with Department of Education, and really, I wish they were on the phone to speak about it because I would want their perspective. And so my understanding, and it's been brought to me before, I know there's discussion about it, is that, yes, previously there was sort of a policy of people being able to opt in. Now the goal is to test 20% on a given day. The testing team will go through it's pre-selected. The testing team will go through the pre-selected list. And if somebody doesn't show up or they aren't able to test them and they have a little bit of space, they can take a volunteer if it makes sense for the day. So that's kind of what I can tell you about the mechanics of the program. The other thing I would say is that I think, after the winter break, we're seeing a lot of people come back who may want testing more quickly than they are pre-selected for it. DOE has priority at sites all over the city. And so for anybody who wants to get a test and isn't on the pre-selected list, we can drop the DOE priority test sites into the chat.
Yeah, that'd be very helpful. Thank you so much. And just one last question. In terms of the vaccination, I know it's very early to say, but a lot of my members are very concerned that will they be mandated to have a vaccine if they service children?
Oh, I'm sorry, I was on mute and you can't see that because of my mask. You are right. I think it is too early to say. I don't have a solid answer for that question yet. I'm sorry, but we will definitely update folks as any conversations happen about mandates or requirements. But at this time, there are not requirements in place.
Okay, thank you.
Okay, next is Trevor and then Jackie.
And may I
Hi.
also have a question at the end? Larissa,
Okay. Okay.
thanks.
Sure. Just a quick question, piggybacking on a couple of the vaccination questions, which you sort of answered, but I have several senior family members who are all over 70 and are not going to use the app or sign up. And as Michelle had mentioned, their doctors don't know anything. What is the rollout or what is the marketing that's going to be done to these seniors who, let's be real, most seniors are not part of senior centers to get vaccinated? I can't tell whether these members are eligible now. They all have health conditions. They're all over, actually, some of them are over 80, but they've got no information on how to get the vaccination or to find out whether they're even eligible to get that. And just two things that are not related, but two questions while you're here is, have you seen a decrease in the flu since we're all wearing masks and not congregating with each other? And with regards to the flu, do you think from your expertise, and I know it's hard to answer, that we're going to have to do this vaccination every year or every 2 years like we do the flu shot?
So first question, yeah, we hear you about seniors needing additional outreach. I think their providers are a great piece of the puzzle, and we have been working actually very regularly with primary care providers. We're going to do a big push around seniors as well, because we know that seniors, unlike a lot of other New Yorkers in particular, they're going to want to get the vaccine from their provider, from the person they know and they trust and they have a relationship with. I mean, a lot of people feel that way, obviously, but seniors in particular, we have heard that. I think that is part of the reason for setting up the call line, so that people can call and do this over the phone and not have to rely on a widget or a computer or a vaccination appointment maker. We're going to be doing a lot of work in the coming weeks to make sure that the word is out to the seniors in various forms of where they are. I understand that not everyone uses senior center, so I think they're a piece of the puzzle, but not the whole puzzle. So yes, we are focusing a lot on seniors. I think any suggestions of organizations that you all have, we have a lot of great relationships with organizations that we've built over the COVID-19 response, given that seniors are obviously a priority population and have been over the last couple of months. To your question about flu, it is a very good question. We have had an unprecedented real flu vaccination year. People answered the call when we asked them to get the flu shot, which is a big piece of our vaccination efforts now, is building off of that success of the flu vaccine. I don't have the data in front of me to compare it to last year, and so while someone else is asking a question, I can try to pull it up. It's a good one about, we're wearing masks, we're staying distant, wouldn't that decrease the flu as well? And I just don't have it in front of me, and I don't want to misspeak. I can't say about the need to get the COVID vaccine every year. I think that a lot still remains to be seen about the length of what type of immunity and the length of immunity it provides. So I think that is more to come. Thank you for your question.
Okay, Jackie, and then Larissa.
Thank you. So my question is about the effectiveness of these two vaccines. I understand they both use the mRNA technology instead of the dead cell technology. So are they better in handling other variants, like UK variants and also future mutations than the dead cell technology? Thank you.
Thank you for asking that question. I will have to get back to you on that, about their ability to handle different variants. I don't know the technical details of the vaccine. I think raising the UK variant is very important, though. I think that folks may be aware about the new variant identified. This is just another call and a reason why we need to remain vigilant right now. I think it is really important for us to acknowledge that we are not out of the woods. So I can follow up afterwards with that answer. I've noted it down, so I'm sorry I can't answer it now.
Thank you.
Okay, Larissa and then Eric Diaz.
Sure, thanks. I have a question about registering to get notification when you are eligible to get the vaccine. I've been helping some family members and some neighbors who are not tech savvy to get on the website so that they can get a notification through their cell phone. But there's only 2 questions on there. The question is if you are a resident of a nursing home, or if you're a resident, or if you're an essential worker working with at-risk populations or COVID populations. So are those questions going to expand as the vaccine is opened up to different groups? Because there was no way for me to put someone on there who was over 75 with health risks.
Sure. I think you may be talking about the New York State tool. Is that
Right,
Is that
the
right?
the New York State website. So I
Got
was
it.
trying to get so everyone can get a notification. It's a great way to do it because you can get a text message that tells you that you are eligible to go get the vaccine at that time. So good
Yeah,
tool.
I have seen it. I didn't realize that they hadn't expanded the questions for additional eligibility categories. I can't speak for the state. We are working at the city level to work on additional notification mechanisms though, and point well taken that it is a good tool to have and ensure that we can do pushes out to people, not just expect them to sit there all day clicking, refresh, waiting to see if they're eligible. So sorry that I can't answer that. I can give you a state contact if helpful, so that we can follow up.
Yes, please, that would be really helpful. I could pass that information on to the community. Thanks.
Okay, Eric Diaz and then Alicia.
Yes, forgive me if I'm in the outside real quick. Can you state the community-based organizations that or partnerships in the Lower East Side specifically that you're partnering with for the senior outreach that you briefly began to describe? And also then, what are ways for local organizations to connect back with you to get testing for older adults outside of senior centers, other organizations?
So I don't have specific names of organizations here with me tonight, and I don't have them for the Lower East Side specifically either. We have a lot of community partners that have been really great throughout this entire pandemic that we're definitely leveraging now. I am happy to take partner suggestions. I can also, if I can take those suggestions and follow up with who we're working with, I'm also happy to do that. But I want suggestions so that we know that we're talking to the right people, you know, and maybe there are partnerships that we don't have yet that you would suggest to reach people.
Last question, comment, I guess, is regarding, I know Cuomo has the priority list, and forgive me if I'm not well versed in it, of those that are slated to be kind of, I guess, important to get tested. There's certain groups there. Do we know, is there some advocacy for the older adults that your agency is doing? And you know, what can we do to advocate for those, for the senior population?
Yeah, no, totally hear you. I think the senior population, he's definitely also identified as have we of them as a definite priority for this vaccination. And he did announce that they would be in the next phase 1B, up for vaccination. We just don't have a timeline on that yet.
Thank you.
Thank you.
Okay, thank you. So, okay, our final question will be from Alicia.
Hi, May and committee members, and thank you guests that are here tonight. My question is, and maybe you've answered it and I wasn't present when you did. The question is about the homeless population. How I know that they have been being tested in the shelter systems for those that are listed in the shelter systems and get there. How will the vaccination be done for people that are in the homeless population of New York?
Thank you. It's a really important question, and I think one that's still under discussion. How we'll be working with homeless shelters in particular to ensure that their populations are vaccinated. So I don't have the total set details with me tonight, but this is obviously another, much like aging New Yorkers, older New Yorkers, and those in zip codes that have been hardest impacted, definitely a priority population for for consideration as well. We have a lot of different ways that we can get folks vaccinated in person, and also, mechanisms to bring vaccination to people. So definitely all on the table right now.
Okay, okay, so that was our last question on this topic, and that ends this agenda item. Well, thank you very much for coming to present to us today, and we will, please, we'll need to follow up with each other on all these questions and answers.
I wrote down my homework assignment, so I will, I can connect with one person and get these answers back to you.
Okay, thank you very much. Okay,
Thank you.
great. Okay, so our next agenda item will be the safe haven proposed for 100 Orchard Street. We have speakers from Department of Homeless Services and also Not on My Watch. Are you here?
Hi, everyone. Can you all hear me?
Okay, there's Leilani.
Yes.
And,
Hi.
okay, so
Hi.
it was Matt, it was
Yes.
Sean. Okay, and Shane, okay.
Shane and Matt. See, everyone is on. I'm not
And do
quite
you have
sure if
anybody else? Just three of you only?
I don't.
Who's here from Not on My Watch?
I don't see them on. I think Matt, you're muted. Can you all hear me?
Yeah, we can hear you.
Still muted, Matt.
Sean is muted and.
Thank you. My age shows whenever I go on one of these Zoom calls and I can't ever seem to get it right. Good evening, everyone. Yes, thanks, Leilani. Not on My Watch is unfortunately not on the call tonight. They, at this time, they sadly, their organization was, I don't want to get too much into the details of it, but was dealing with a tragedy that happened to someone close to their organization today. So they're actually at a vigil right now for that person, but they really want to speak to the community and definitely want to, if they're not available tonight, want to find another time to come back ASAP to make it happen. It just, a terrible, terrible thing happened. And I was hoping that they would be able to be on it, but obviously sometimes life, some things trump the meeting, and I understand why they can't be on it tonight.
Can I speak to that a minute? Because I spent a lot of time on the phone today with Not on My Watch and with DHS. And I was told they would definitely be here, including, from the Reverend. And I explained how important it was. And I think that we could have at the very least, I know it's very tragic, but I think at the very least, we should have been told that they're not coming. Their vigil is from 6 to 7. And so we had arranged that they could come after that. And if that all fell apart after I spoke to everybody at DHS and at Not on My Watch, I think we should have at least had notice.
Susan, I think that you know me as someone that is very committed to the community process and obviously very committed to our partners. This is a very unusual, horrible situation. I can't speak to if the vigil's going longer or not. I think it's not appropriate at this moment to sort of opine upon that because they're dealing with a tragic death. I do want to note that they are willing to come back at another time. This just happened to be something that happened. I totally understand what you're saying. I appreciate that. It is not ideal, but unfortunately, life sometimes presents situations that are really challenging for us to go forward. So we will do our best. We are happy again, be committed to coming back again. I think obviously we can certainly answer larger questions regarding this site, and then obviously we'd be happy to come back for to have a follow-up if they're not on. So
you'll present about the site. You'll give all the
exactly. Yeah.
Okay, yeah, it would have been nice to have them because they always provide information that you don't just provide what about what they're really doing.
They're happy to come back. I don't want to speak in code, so So folks, it seems I'm being mysterious here. They operate different programs. One of the programs they operated, a woman that utilizes one of their programs was murdered in cold blood and in a very tragic and horrific fashion. And so the leadership is engaging with the grief of the community tonight for this terrible event. It has nothing to do with homelessness or anything like that. It's a different program that they operate. They are human beings and people, and they are trying to balance, all of these varying needs. I would love them to be there tonight to obviously talk about this, of course. But this is, it is what it
Okay,
is.
all right. Okay, I mean, Susan did describe it to me a little bit, what will happen. So
Yeah, I know
since
there
you
are
are
other
here
people on the
anyway,
call.
and
Yeah.
many people have been waiting like for a whole
Yeah.
hour because they signed in, why don't you just give the presentation and we will have questions and answers. And then, we'll see what goes from here. We need to reschedule another meeting with them.
Okay,
It
thank you. I
looks like
appreciate
we
it again, and
might.
I'm sorry. I am really sorry. I am, again, I do apologize, and I understand where folks are coming from. So yeah, once again, my name is Matt Borden. I'm joined on this call tonight by my colleagues, Leilani Irvin, who is our Manhattan Borough Director, along with Shane Cox, who is an Assistant Commissioner for Street Homeless Solutions for DHS. The site that we're talking about tonight is located at 100 Orchard Street, and it would become a safe haven for folks that are facing chronic street homeless issues. Just a little bit of a background on this kind of work that we're doing. So obviously right now, certainly as the weather gets colder, we all realize that, folks being on the street are incredibly problematic. And certainly when it's nice like tonight, when it gets, colder than 32 degrees, we have cold blue weather alerts that happen. And we really have to increase the number of outreach teams that are on the street. And we've really, as a result, have tried to figure out what are ways that we can really meet the street homeless population where they're at. Community Board 3, for as long as I've known, has been very open and receptive to the concept of this particular type of program. Safe havens and stabilization beds offer folks who are experiencing street homeless issues kind of a first level of service when they come in off the street. And in this administration, we've actually have opened more than 1,200 of these kinds of beds dedicated to supporting individuals who have been unsheltered. And actually, we've opened 600 since the summer, which has been terrific. Part of this work that we do really involves the street teams. And so before we get into this site, Shane, could you talk a little bit, just give us an overview of sort of street homelessness teams in New York City, how they operate, and then how we can talk about how this site fits into that?
Yeah, absolutely. Thanks, Matt. Hi, everybody. Again, I'm Shane Cox. I'm in the Street Homeless Solutions Unit here at DHS. So I know many of you are familiar with downtown Goddard, but just I'll explain just briefly what they do and then how it would fit into a safe haven. So essentially, DHS contracts out with nonprofit providers who are responsible for doing 24-hour a day, 7 days a week, hurricane, storm, holiday, whatever the case is, COVID, non-COVID. They're responsible for engaging, identifying, monitoring, and assisting anybody who is on the street, assisting them to get off the streets. Each borough, more or less, has one agency, one nonprofit that covers the borough. In Manhattan, it's a little bit different. In Lower East Side, CB3, you guys, Manhattan's broken up into different areas, but in your area, it's Goddard Riverside does the homeless outreach. So I'm sure many of you know their work under CUCS, who has the contract for Manhattan. But essentially, what these teams are doing is, again, they're responding to 311 calls, they're responding to community concerns, and they're just doing general engagement, general canvassing. They are responsible for engaging anybody on the street who they think is homeless. And everything they do is oriented around housing. Now, in the meantime, in order to get that person to housing, there's lots of steps. And there may be a lot of other services that the individuals need. And if they're not interested in housing, but interested in another service, then the team would be the ones who'd also be working with them on service. So if they needed treatment, or if they wanted to be connected to mental health services or medical services, or just they want to go towards permanent housing, they want to work on a city for HAB shelter, whatever the case is, just general case management, the outreach teams would work with them to connect them to those services. And then hopefully in the course of that conversation, in the course of that work, build the trust so that somebody would be willing to work with them towards housing. Now, permanent housing is the real goal. That is really where we're trying to get with everybody. And that is just, the goal is, sometimes for chronically street homelessness, often where people with appropriate model of supportive housing, which is permanent housing with lots of services on site, and they're kind of wraparound services, they're called. They're really there to help people stay in their housing, get acclimated to permanent housing, and if there are issues, they are there on site to help them work it out so people do not return to homelessness. But in the meantime, the Street Homeless Solutions, our unit, also has other sites which are called transitional housing. So those would be, there's kind of a spectrum, but they're the three main kind of areas where we maintain drop-in centers, which are just areas, just programs for people to go in. They're generally chairs, case management, people can get access to food, showers. Those are really just a place for someone to come in off the street. They really don't want a bed. They may not want to commit to a program. They don't necessarily even want to work with the team. They just want to come inside and get some services. So they would utilize a drop-in center. We have stabilization beds, which are a low threshold model. Those are models that are run by, again, nonprofit providers. Sometimes the outreach teams run them, sometimes there are other providers. These are a form of housing kind of geared and built around street homeless individuals. And these tend to be for kind of higher functioning, more independent individuals. Some of the staffing, they have general case management staffing on site. But again, these are places for people to come inside, to get off the street and to work with the team towards permanent housing while inside. And then we have what are called safe havens, which again are really geared towards and built around chronically street homeless, the most vulnerable individuals on the street. So these are the individuals who've historically not wanted to go to the shelter. They may not want to go to drop-in center, stabilization bed. But so a safe haven, again, it's low barrier, low threshold, which really means that there's no sobriety requirements, there's no curfews, and they're kind of rich, they're clinically richly staffed to help people with an array of services and really kind of help them stabilize and then work with them towards permanent housing. And the teams, so where it would fit in is Orchard Street would obviously be a really useful tool for the team. So one of the ways the teams are engaging people, obviously a lot of individuals who are homeless want to stay in the areas in which the team is engaging them. Those may be their neighborhoods where they're originally from. It may be where their support network is. It may be where they feel comfortable and are familiar. So what we run into sometimes is we may have a room available for somebody, but it may be in another borough, or even within the borough, it may be uptown versus downtown. It may be in an area where they really don't want to go. So often, services such as safe havens or stabilization beds are a real way to engage people in the general area, in the general neighborhood, and really engage them around coming inside. They can still, access their support network. And what happens is for safe havens, the referrals come in from the outreach teams or from DHS. And the referrals, once an outreach team finds somebody, they would be in touch with the safe haven, they have a bed, they would work with the safe haven staff around intake, and then the outreach teams would still remain engaged with the client and still work with the safe haven. If there are any issues or if there are case management needs, whatever the case is, it's sort of the outreach teams and the safe havens then are working together with the client to maintain the contact, keep the rapport, and still work together collaboratively to get them onto permanent housing. So I can certainly get into a little bit more details of what it is, but again, the safe haven model is really built for street homeless individuals. So again, there might not be a curfew, people can come and go a little bit more than it would be able to in a traditional shelter, but they're also very richly staffed. It could be a little bit smaller. And again, they're really geared towards working with people, understanding the population, understanding the needs, providing the full spectrum array of services that they need to keep people inside. And so it's a very useful model. And again, it's very neighborhood based. We often find people who were really previously had not wanted to come inside may really be interested and start thinking in a different way about coming inside, when coming inside means they can stay in their own neighborhood, their own community. So I can certainly, and I know that was fairly quick, I can certainly answer any questions. I don't know if Leilani or Matt have anything else to add, but that's just sort of the general model. The safe haven, no, I just want you to know it's part of the spectrum of street homelessness, and it's part of the outreach team, and it's part of the whole system, and it's fairly integrated, and it's all built around keeping people inside, stabilizing them, keeping them, getting them healthy, and really working with them to get them into permanent housing and helping them move beyond stabilization bed. And particularly in winter months, it's a really obviously necessary and vital tool that we have to keep people inside.
Yeah, I see, Susan, that you raised your hand.
Yeah, could I, if I could ask a question? So Community Board 3 always wants safe havens, and we've had them on our district needs statement for years as a high priority, but we don't know anything about this specific one. Could you talk about how many people would be there, how you fit them in? Can you create outdoor space on the roof? Exactly what services, who would the population be? Can you talk specifically about this safe haven?
The population would be, I can't get into a whole lot of specifics. I mean, I think not on my watch. I don't want to speak for them around some of the specifics in terms of, some of the case management they're going to be doing and some of the specific services. But, the population is going to be the street population that Goddard and the other outreach teams are finding and working with. Obviously, definitely in CB3 and in the area, but also just in general in the 5 boroughs. It'll be chronically street homeless, although it's really, safe havens are really built around, people who are very vulnerable and who really need the kind of extra layer of services. So that's primarily who's geared, what the model's geared towards.
How many people in a room? What kind of exercise or recreation space?
So I know that it's 70 beds is the capacity. It's going to be the capacity, but once it's first launched, it's going to be stabilization beds, so it'll be capped at 50. Is that right, Shane? 50 beds for stabilization.
Yes, yeah, 50 beds, and it's expanding.
When you have the 70 beds, how many in a room?
I don't know if exactly how. We'll have to get back to you on that. Follow up and not on my watch. I'll know exactly how they're going to configure it. I think that's still probably being worked out.
Oh, so when it's the safe haven, it could be 70?
That's correct. That's the capacity, 70.
70 people and 70 beds, right?
Yeah.
70 beds.
That's what you're saying.
Correct.
Yeah.
Correct.
But we don't know how many rooms, how many
Not-
units.
That plan is still being ironed out and finalized. So this is also a purpose-built facility, so construction is currently ongoing at this location. So that has not, unfortunately, I don't have floor plans to share just yet. But once that information does become available, I'll make sure that we come back to share with the community board. And also whenever Not On My Watch makes themselves available to come back to the board, I'm sure I'll let them know that this is a piece of information that I want to know and want clarity on.
Okay, so I'm going to if we have nothing more to present about the specifics of this facility, it looks like it's for Not On My Watch to do it. I'm going to do that, right? You have nothing else to say about this, is that correct? Because then I'm going to take questions and answers. Leilani, do you guys have anything else to add?
No, and unless there's, I think it's appropriate now for us to take questions, and we're happy to.
Okay, so okay, great. So I'm going to take questions first from the board, committee members and board members, the committee members, and then we have a number of elected officials here who don't know that much about this yet, so they will go next, and then after that, everybody else. So the first person who raised their hand is, well, actually it was Alicia. But Alicia, you can go first. And then Alicia and then Heidi.
Okay, good evening, everyone, and thank you, committee members, and also elected officials and members of DHS. So just this is very personal for me, and I will share this because the community board knows. I just lost my brother. He was a street homeless person, and he had very special needs, and unfortunately, the needs that he had were not being met. He was in and out of the shelters for a numerous amount of years. So my concern for this particular location, and I know you can't speak for the organization that will be running it, but I just wanted to make sure that the safety was always an issue that my brother complained about constantly in and out of various shelter programs. And it is just an issue across the board. Not just, I don't know how this organization is going to run this particular shelter, but I do know in the location in which they're going to be, there are a very large amount of bars, and it's a very busy area on Orchard Street. And I am very much concerned about the safety of the men or whomever it will be placed in that particular shelter system in that particular facility. So I want to make sure that there is proper security for them and that the safety is being thought about. They're coming and going as well. And we also know that the Lower East Side is a culprit for different types of drug use. And that's anywhere on the Lower East Side. So whether you see it or you don't see it, it's still there. And I just want to make sure that they know what they're getting themselves into by putting men in this particular population in that particular area. And again, I'll say, you know, being a person that has a recent loss of a loved one that was afraid of the shelter system, I just want to just convey that we need to be very careful where the placement of people. Okay, thank you.
Yeah, I'm very sorry to hear about your loss and your brother's experiences. I should just, you know, I think I could speak for Not On My Watch to say absolutely. They are extremely concerned and committed to the safety of these clients. And you know, this particular population, the street population, people who've been on the street, chronically street homeless, aside from being very vulnerable, you know, it takes a very long time sometimes years upon years for the teams to build the necessary trust. For someone to trust them enough. Safety is often a concern of theirs, and trust them enough to go with them to a site. So it's a key part of the whole safe haven model is really building and keeping that trust and keeping people safe and responding to their needs in a different way, knowing that it's a very different population and they have probably had bad experiences previously at some of these sites, but other sites. And so it's actually an integral part of the safe haven model. So absolutely. And the where people are placed, certainly in a street outreach system, it's not just filling a bed. Obviously, we want to get people in as fast as possible. And the minute they're ready, we want to get them inside. But, the outreach teams are very concerned and make, very thoughtful and clinical and try to make the most appropriate set placements possible where they think people will thrive and succeed. And if it doesn't work out, that is not the end of the story. They absolutely are either bringing people back and working with them more or bring them to another site. So I just want to say absolutely. I mean, that is a primary concern, safety in and around the sites. And again, the outreach teams are connected with the safe haven. They're not necessarily they're not employed by the safe haven or anything. They're not connected, but they are still in the area. They are still in touch with people who are on the streets. So it's kind of a whole system that is still helping and monitoring and watching people. But so it's absolutely a concern of theirs and a key issue that they'll be working around and designing programs around and services and structuring the whole operation around. Right? So I think that makes sense to say.
I just want to add to what she said. I'm really, really deeply sorry to hear about your loss. Thank you for even sharing that and being, open and transparent about your brother. That's really tragic. One thing I did speak with Not On My Watch about is something that we're doing at other locations, which is we have security that lend themselves beyond the site. And so they have made a commitment to do external canvassing around the perimeter of the site. And that's really not to act as police, but really just to ensure that, you know, monitoring the clients as they're leaving, and if they need assistance, should they need assistance or any support, if they're out there and they need PPE masks, those are things that the provider is willing to, you know, offer clients should they see them outside of the site, but also to continue the engagement and connecting them to services or linkages in the community. So that's, I think, a very important factor that they committed themselves to offer here at this location. So they'll be doing perimeter canvassing checks in this area. So there'll be security inside, as well as that they'll be doing patrols externally outside of this site. And again, it's would be great that in places where we are doing this, it's helpful because the providers are able to engage clients as they observe them. Should they be just, you know, I don't want to use the word loitering, but should they be hanging around the area? I think that's very important. We want to make sure that we're constantly engaging clients, and that's something that they committed themselves to do here. Just wanted to share that with you all, but I just personally, Alicia, wanted to send my condolences again to your sibling. So unfortunate. I'm sorry to hear that happened.
Thank you.
Okay, so next, okay, so as I said, I'm taking committee and board members first. So it's Heidi, Deborah, Eric Diaz, and then I think Megan.
Hi, everybody. Former colleagues.
Hi.
Yes, nice to see your faces. So I had a few questions. I think Susan kind of reviewed some of them before, but so that we can get more information, if you don't have it now, maybe later from the provider. Something that we know is super important at any type of shelter, safe haven, stabilization beds is community space where either people can gather indoors and they are permitted to be there, and there's services and programs, really rich services and programs throughout the day. So I'd like to hear more about the actual programming, what that would look like. If there's going to be any outdoor space at the shelter on East 3rd Street, that outdoor space, I think, relieved a lot of that pressure that came from the community in terms of safety and security. And I guess tying in that aspect of it, not necessarily bringing the cops in on this to criminalize the people who will be using the safe haven, but really hoping that they know that this is going up, because we see a lot with East 3rd Street, with the women's shelter on Avenue D, that there are a lot of folks who come to those neighborhoods to sell drugs to people who are living in those shelters. So they're really preying on people who are in that neighborhood and who are vulnerable in that way. So making sure that the police know, you know, and maybe can step up patrols for, it's really to target the people who are selling, not so much the people who are buying. And then, you know, I just wanted to reiterate to what Susan said about the district statement. Every single year we've asked for stabilization beds and safe haven beds in the community. It is extremely difficult to get them for a variety of reasons. So I'm happy to hear that we are getting safe haven beds. I just really want to emphasize, I think all of us in terms of the community board members, I would hope that we support the safe haven, but also advocate to make sure that it is run in a way that preserves the dignity of the people who are living inside and convinces them that it is a safe space and that they can come into this safe space. So I think we need to advocate for that. And then also DHS and the provider needs to uphold that commitment.
Thank you so, wait, I think I'm unmuted here. Thank you so much, Heidi. I really appreciate that. It's good to see you again. I'm really sorry that Reverend English can't be here tonight. I know that the issue of street homelessness and trying to help those in need is something that's very personal to her. And she has a lot of passion for this work. And I think that she is really wanting to create the kind of space which you would envision in terms of trying to have a location which people feel safe and really provide the safe haven from where they are right now. In terms of issues with NYPD, I know that from previous conversation that the Reverend has met with the local NCO of the precinct to talk about when this site opens, what it might look like, and how to make sure that they do have a good relationship with the local precinct. And in terms of the space that's a part of this site, I don't have that answer. So we definitely need to get back to you on it in terms of what facilities are offered. I know previously this was obviously a hotel that was used. So I imagine that there's some communal space, but I can't speak to it.
All right. Next is Deborah Glass and then Eric Diaz.
Hi, thank you very much for coming and speaking with us. I guess I have a couple of questions. As you mentioned, I think it was Shane who talked about this community board, or this community has always been open and welcoming to, everyone who needs to be housed in this community, including Rivington House, which took in AIDS patients when no one else would take them. I guess my question is relative to, it's two questions actually. So relative to the number of homeless sites in our district, like what's the process for DHS finding these little boutique areas to place safe havens? And I know that we as a community need safe haven beds, but how does that process work? Is it that a hotel can say, I'm not renting anything, so I want to sign up with DHS to try to do this? So I'm just curious about that process. That's number one. And then number two, I know that it is a small hotel, and I'm only going by what I read in newspaper articles where, there's sort of a pushback about this, the numbers of folks that are expected to be housed there relative to the numbers of rooms that are there. So how is that different than a congregate shelter? If it's a hotel that has 30 rooms, I don't know how much construction they can do to make that not be the same as like a dormitory style shelter if you're going to put 70 people in there. So if you could speak to that. And then I guess those are the two main questions.
Yeah.
I have. Thank you very much.
Those are both really excellent questions, and want to answer both of them. So starting out, we're only going to have up to 50 individuals using this space. It's not going to be where the maximum is, and we're obviously not going to use anywhere approach that until it's actually safe to do so. So that's the first thing. And in terms of determining what space is, right now for our shelters, what we've done is really whenever we can, we've de-densified them, and so we basically have been operating at 50% capacity many of our single adult sites. And so with obviously being really thoughtful and careful regarding how close folks can be during this time. And so that's obviously what's going in. And when we'd be operating the site, we'd want to make sure that it was not packed and not a safety hazard, because the point is obviously to make sure that people are safe or not create a situation in which they're more at risk. And so we'll be very thoughtful about that in terms of the number of folks. And I will say that with our current setup right now that we have, our COVID numbers within the DHS system are actually lower than the cities itself, which is kind of a remarkable thing, both among our clients and among staff. So the prevention methods that we've taken so far have been effective, and we imagine that they will be so here as well. And in terms of how does a site become a safe haven, in this case, and in most cases, a provider will basically link up with a property owner and present this as an opportunity for us to go forward. It's a lot of right now, there is a demand from hotel owners to want to work with our agency, obviously in part because the hotel market in New York City is pretty terrible right now. So in this case, providers come to us with a property that they have site control over of. They create a proposal. That proposal gets rated. And then we go ahead and figure out how to move forward with it. Thank you.
So thank you. I guess I'm coming from the era of the 80s where, you know, it was another period of an economic downturn.
Yeah.
And hotel owners saw this as an opportunity, and the secondary things that happened when they became shelters. And I think that a lot of them were family shelters. Some of them were men's only shelters or women's. So I have this, you know, there is this moment of thinking, are we entering back into that phase where, you know, there's a moment where there's an opportunity for a business owner, and I know that, you know, things are really raggedy right now and they need to sort of, you know, do what they need to do to keep themselves afloat. But does DHS have the capacity and the wherewithal to make sure that the things that are being promised once these sites are opened, whether that will continue in a way that makes sense for the community and for the folks who populate these environments? So
Yes, I appreciate that, and I hear what you're saying. I hear where you're coming from.
Okay. Okay, next is Eric Diaz.
And thank you again.
Thank you.
Eric? Is Eric still? Eric Diaz.
Hey.
It worked. It worked.
I'm on?
Yes, you're on.
Yeah.
You're up, Eric. Go ahead.
I'm sorry, I don't mean to be yell at the screen. Two
No,
quick
no.
questions. First one is, and I'm sorry I missed it, is this a teen focused safe haven shelter that's being proposed?
No.
For teenagers? No, it's for and what's the population again?
It's for just single adults.
Got it. So single adults. Okay, my son. Second and last quick question. Reverend English, is her first name Q? Is this Reverend Q English? Yes. Oh, okay. That's a good friend. I didn't realize. Okay, good. Good to know. She's good. Those are two questions. Thank you, guys.
Thank you. That's and I appreciate your multitasking you're doing right now.
Okay. Okay. I know I see 3 more people with their hands raised, but I just wanted to know, do any of the elected officials, do you have questions? Because I know that you, I think maybe you're hearing this for the first time as well, directly from DHS. If so, you should raise your hand, although I don't see any of your hands raised. And maybe that means that you don't wish to ask the question. Okay.
Gigi's hand. Gigi's up
Okay.
there.
Gigi.
Yes, Gigi from
Hi,
Councilmember
can you hear
Chin's
me?
office.
Yes.
Hi, good evening. Gigi Lee, Chief of Staff for Councilmember Margaret Chin. So our office is not hearing this for the first time. You know, we were notified, I believe it was the week, was it before, the week before Christmas, I think
Right.
it was, that we first heard from City Hall, and then asked very rapidly, and it was arranged for a call between the provider, the community board, the bid, DHS, and City Hall, right, to discuss just some of the initial concerns that were raised, many of which are the questions that were just asked by some of the board members. You know, the council member has a lot of concerns which remain about how this is moving forward in terms of process, in terms of whether other sites in council district, I'm sorry, in community board 3 were, you know, considered for this same population, and sort of why this one, and if others were, why this one was ultimately chosen. Because, you know, our office, along with other partners, have been dealing with and unable to resolve a lot of significant quality of life issues on this block, right? And so I don't want to rehash everything that you know, Matt and Leilani, you know, and I have talked about, but I think what is concerning still, understanding that there was a tragedy that the provider is dealing with, is that in the course of 3 weeks, we haven't gotten a lot more information, right? And I think that is concerning to us. And so I think right now, you know, if you are planning to move forward with this location, we would really like to just have a more consistent and open line of communication, both with DHS and the provider. You know, I think that if it weren't, and you can tell me if I'm wrong, and maybe there are lawyers that need to speak to this, and you may not be able to, but my sense is that had it not been for the kind of legal approach that has you know, been taken, that, you know, this may have just happened and happened already, because some of the dates that were initially circulated were to move individuals in next week. So, you know, I'm gonna leave it there, because I think other people and other offices who are hearing this for the first time may have other questions or other concerns, but I just want to flag those, you know, on behalf of the council member and our office.
Okay, any of the elected official represent, thank you, Gigi. Any of the other elected official reps who are here today, do you have anything to ask or say? Well, I don't see anything right now, so I'm gonna go back to this list. Okay, so next is Tim Laughlin, and then Anisha Stephen, and then Trevor Holland.
Thanks, May. Can you hear me? Thank you so much. I would just, I think, echo a lot of what Gigi just stated. Let me first say, Alicia, I'm so sorry to hear about your brother, and you know, he's in my thoughts and prayers along with you. But I think you raised some really valid points as well about this specific location. And I know that we've expressed those directly to DHS and City Hall. As we all know, we have a significant problem with quality of life, especially at night. We know the concerns related to public safety and the exacerbations of those concerns when we're talking about open streets and Health Square. I also, just with respect to this particular hotel facility, while I appreciate completely the need of a hotel owner who has not been in operation and a lot of things going on with COVID to try to arrange for a financial transaction that makes sense for them, I think some of the other comments before were really appropriate here. This is a converted tenement building. This is a 22-room hotel. The certificate of occupancy for the ground floor, which is the only common space, states that only 30 people can be in that common space. There's only one common space. It is the ground floor, and it's for 30 people. I'm concerned, especially when we talk about a safe haven model, that it is vulnerable individuals who really need those supportive services in a safe haven. And I don't think that they're able to be appropriately provided, especially in a safe place that is fully indoors, right, within the facility. And moreover, you know, when we're talking about individuals who may be struggling with substance abuse and really trying to recover and get themselves on their feet, frankly, citing a facility like this in an environment that is at night, the only description can be Mardi Gras, is really problematic for me. And I know just from my position as president of the local business improvement district, that there are significant concerns with intoxicated individuals doing stupid things on those blocks. And I think the last thing we want to do is put individuals who are vulnerable and in a situation like that they don't have to really interact on that front. And just moreover, from a process perspective, this is the first time that a lot of people in the community are hearing about this facility. I think it's important to note that, as Gigi noted, we were informed this would open as a stabilization site just shortly before Christmas over the holiday. I don't know if that is still occurring, but our understanding is that it might, and there will be likely a transition to a safe haven model. And while I completely appreciate the unique situations of the not-for-profit provider and why they can't be here tonight, I also just really think that the community needs to be better engaged with that provider. They need to know exactly what the plan is for this facility. They need to know exactly how that security is going to interact with the local precinct. They need to be able to explain very specifically the construction and other things that they're doing to provide the appropriate level of services for these individuals at this location. And frankly, they need to explain how they intend to do that, given this, from what I've been able to surmise, is the first shelter operation that this not-for-profit provider will operate, right? So all those things combined make this specific location with this specific partner incredibly concerning from the perspective of the clients themselves. And I think from the potential for, hopefully we won't have negative interactions, but the potential for those negative interactions on the street at night itself. And so I would just ask that the city continue an appropriate period of due diligence before making any final determinations and do a better job at engaging the community and making sure that the proposed providers are actually doing that community work too before an operation commences.
Okay, thank you, Tim. You know, hey, Anisha, you know, I put Megan's name on after Eric, but I forgot to call her. Do you
Totally.
mind if I call her now?
Go for it, Megan.
Megan Joy?
Thanks, May. Appreciate it. So I own Lucky Jack's, which is at 129 Orchard, just across Delancey from the Blue Moon Hotel. And I think my main concern here is seeing the crowds of people that came to Orchard Street, more so south of Delancey, but still north of it as well. The amount of crowds that came to that area with the outdoor dining was exorbitant. And with that, it also brought in a lot of drug dealers. So we were getting a lot of attention from drug dealers in that neighborhood because all the patrons of the bars were outside and they were making for easy targets. So I've got concern about that. Maybe a shelter might attract more drug dealers, or might not be the best environment for people who are trying to recover and stay safe. So that's my concern. My question is, how long is the contract that the city has with the Blue Moon Hotel currently? And how long does it plan to be? And I think I heard right, Tim said that not on my watch. Do they not run any other shelter? Would this be their first shelter that they're running?
Not a shelter.
Safe haven, sorry.
Thank you.
That's my two questions. So is it confirmed that this is their first safe haven, and two, how long is the contract, the city contract?
This is their first safe haven. Generally, so the contract that the way that these contracts work, that between DHS and when we operate a site, is that our contract isn't actually, we don't have any really connection to Blue Moon. What we have is a connection to the provider, and we pay the provider money, which they then turn around and use to pay the rent to the owner of the Blue Moon, as well as provide services on site. The contracts that we have for these types of facilities usually are 4 years, and then with an option for a renewal for another 5 years. And so, generally, when a site opens up, they tend to stay around. I mean, some sites do close, but just generally when a site opens up, it remains. And in this case, obviously not on my watch can talk more about the kind of work that they're going to do to ensure the safety of their clients. I think, again, knowing their passion about this subject matter, I think that they would not want to open a site in an area or a place where they felt that this was going to put their clients at risk. However, I can't speak for them, and I don't think that'd be appropriate to do so. But I will say that we do obviously have sites all across New York City and lots of different neighborhoods and communities. And, we really feel strongly that, the circumstances that we can provide shelter and getting people an opportunity coming off the street are really is a terrific opportunity for us. So we are obviously supportive of this site, but I do think that it's more appropriate for Not on My Watch to talk about the specifics in terms of how they plan to operate it in a way and work with the community, because they're the ones that are actually going to be there on the ground every day and be your neighbor.
Okay, thank you. Okay, Anisha, before I get to you, I just got to remind people about the chat box. Okay, the chat box is to be used for if you are signing in or if you're having technical difficulties and you cannot, you cannot like raise your hand or speak. Okay, if that is the case, Larissa will assist you. The chat box is not to be used to make comments. If you wish to comment or ask questions, raise your hand and you will be called upon. Okay, speaking in the chat box is equivalent to as if we were in the room and you were having a rather loud conversation in the back. Okay, in that case, I would ask you to take it outside, but there is no outside to go to. So please don't use the chat box. Is that clear, everyone? Okay, seeing that there's no answer, I guess it is clear. Anisha, you're next.
Thanks, May. Megan sort of asked my question, which really was, I lived next to this building for a number of years, so I'm actually very familiar with it. But I know that they are not here the operator isn't here to speak about the specifics of how they will operate the building, but I was curious sort of what the relationship is between DHS and that operator, since it is the first, I guess apparently the first site or safe haven that they are operating, and what due diligence went into it. Have they had other city contracts before? Things like that. I guess I am surprised to hear that it's the first one, and if they have a connection to this neighborhood otherwise.
Well, in terms of providers, we obviously, folks can talk about how the process works. Shane, can you talk a little bit about what the proposal process is like for a site like this?
Yeah, and let me just say, DHS we'll be working closely with them as they roll this out and work on a safe haven. Obviously, we'll be overseeing the contract and really, we've been working with safe havens for quite a while. And so we'll be with them the whole way through, and obviously working with the community, continuing to work with you and the community as well, to act as a bridge, but also just to help if there are any issues, any barriers, whatever the case is. We'll be there to also help and show what's worked, what hasn't worked, and just be with them. Yeah, I can't get into a lot of detail. I'm not totally familiar with the RFP process, but they put in they answered an RFP and it was cited and rated, and we've been working with them since the beginning, talking about the model, since they going over what we've experienced, what it's going to look like, going through the ideas, what does programming look like, how could it fit. Again, they'll get more into the specifics, but really discussing what a safe haven is, what the model is, what the clients are like, what the expectations are, how we handle certain issues that arise, how we'll handle them at other sites. We'll be working with them and have been working with them a lot. So,
okay, thank you.
A person called a program administrator who will have direct oversight. Essentially, they'll be like acting. But can you all hear me?
No, could you speak louder or be closer to the mic?
Maybe it's my Wi-Fi. Can you hear me better? No? Okay.
Okay.
Well, I was saying essentially there's a program administrator that will be on site, and they'll act as a liaison between the agency, and they'll have oversight with the provider. Should there need to be a transfer for the client, they'll work with DHS to find another bed placement, and they offer supports to the provider as well as clients if need be. I hope you all can hear me. Okay, great. So there's constant, there's always, whenever we notify on a shelter or even a safe haven in this case, Whenever anyone enters a contract agreement with the agency, you always will have a point person that has oversight of the provider. And so that person is typically called the program administrator, and that one will be placed here at this particular location that Shane was just discussing. I'm sorry, I don't know why folks can't hear me. I don't know if it's my Wi-Fi, but I hope I was heard.
Yeah, it's better now, actually.
Thank you.
I mean, I think the goal is if there are issues, we are there to address them. We want this to succeed as much as you guys, and we want the relationship to succeed, and we want the clients to succeed and to be able to move on. And so as does the outreach teams who will be placing the clients, and as does the analysts and the administrators who will be working with the site. Safe havens are a very special model, and it's a special group of people we'll be serving, and a very vulnerable group of people we'll be serving. And so, nothing is taken lightly with these, and it's really, it's hard work, and we'll be there with them and with you guys to make it work. And that's really the goal. And the goal is to have these clients succeed and have it be a place of safety. Again, working with this population, just to go back to the beginning, we're well aware of the concerns and fears that they may have, and how much trust it takes for them to put in, how much trust they need to put into the team into the program to come inside and to work with us. And so we take that very, very seriously. So I'll just reiterate that. I mean, I know whatever concerns, and we work with a variety of providers, and a variety of skills and needs, and we'll be there to augment and work with them. And if there are issues, to be able to address them in as close to real time as possible. And that's sort of, it's 24 hours, and it's the outreach teams involved and everybody involved, and we're all there to make sure this works, because it has to work, and it's worked in the past. It's a very good model, which is why we keep using it and continue to use it, and we stand behind it. And so I think with everybody, we can make it succeed. It's not going to be just them. I mean, it's not just going to be they're going to do it, start, and then that's it. There will be a whole group of people helping them in there.
Okay, so I'm going to take about 4 more people, and then we will finish this conversation. So the 4 people are Trevor Holland, Michael Forrest, Karen Jackson, and Susan Stetzer, right? Yeah, Susan. Susan will be the last person. So next is Trevor, Michael, Karen, Susan.
I'm going to apologize in advance because I don't know as much as I should know about this. My question really has to do with process. I wasn't going to speak until I heard that the public officials and people really didn't know about this. I know folks have asked about the process, but I really didn't get an answer as to the process of informing residents and people who live in the area. So that's my first question. How do you inform people who live in that area, who might live next door to it? Like I know one of the committee members said that she used to live there. Do they find out after it's open, or is there a process of informing people who live there before it opens? And my next question is, you mentioned the downturn in the hotels. There are quite a few empty, or not empty hotels, but hotels that are in trouble in that area going towards Allen Street down the canal. And are those also targets for these potential types of housing models?
Sure. So we don't target hotels. So we don't approach hotels. Folks come to us if they're, if they're interested. I have not heard of anything else for any other hotels that are being considered or being used, to answer your second question first. And then in terms of notification process, the way the notification process works is when we notify on a site, we let the community board know, we let local elected officials know, and then we work with local community boards to have community meetings about the site. So there is no direct notification from the city regarding folks that live adjacent to a site. However, providers generally reach out to those individuals as if they're going to be their neighbors to talk to them.
So that reach out to the community board and public officials is done before you open the site then?
That's correct.
All right, thank you.
Sure.
Okay, Michael Forrest.
Yes, hi, thank you. So I know Gigi mentioned it, but there is a lawsuit that has been filed. And, this was basically, when this first sort of came out and people started finding out about it, it was the week before Christmas. And the message was that this shelter was, or this safe haven was opening on January 1st. You know, a bunch of property owners and business owners scrambled to try to find out what was going on. There was virtually no information provided. And with all due respect, there's been no information provided tonight. I mean, I have sat on numerous community board meetings where restaurants have to provide more information than you guys do. I mean, there's no floor plan. There's no discussion of services. Like Tim pointed out, this is a tenement building that was converted into 22 little nooks and crannies of rooms that you're looking to put upwards of 70 people into during a pandemic, which just by definition sounds crazy. Not to mention that this is on one of the busiest nightlife blocks in Manhattan. And I really wonder, you know, from DHS and from the nonprofit, who really understands this neighborhood? And isn't the process of coming to the community board the opportunity for the community to really voice their concerns and show what this block really is? I mean, this is a terrible, terrible location. And I don't think anybody on this call, myself included, would challenge the need of these vulnerable individuals. But if you know this block, like I do, this block is, it's for lack of a better term, it's a shit show. There's open drug use already going on. There's a methadone clinic around the corner. There's people, I mean, it's a terrible, terrible, terrible location. It's also across the street from the Tenement Museum, which is a designated national park, which has busloads of kids every day being dropped off in front of the Tenement Museum. I mean, if you just go onto Google Maps and pull up 100 Orchard Street, you'll see a bus sitting.
I'm sorry, Mr. Forrest. Could you have a question? Could you turn that into a question? Because it's already 8:30.
Sure. My question is, okay, my question is this a temporary facility? Is this a permanent facility? And given the fact that the nonprofit was not able to be here tonight, will we be given another opportunity to hear from them before this location is opened?
So I'll answer your last question first. Absolutely. The nonprofit is happy to figure out a time to come before the board to answer questions. I think it's actually imperative that they do so. So that has to happen, and we're happy to work with the community board to make that happen. In terms of, is this a permanent site or a temporary site? So it's going to open with stabilization beds first as the plan, and no sooner than February for stabilization beds, and then after a certain period of time, that program would be modeled, would transform into a safe haven, which has a little bit higher level of services that are offered. And so there's nothing necessarily permanent about it in the sense of anything is permanent, but that's what the current plan is for it. And in terms of your concerns, I hear them. I will say, just in terms of like the proximity to children, I do, we have these conversations a lot, and I do think oftentimes that folks feel very concerned when there is the idea of putting these kinds of facilities in proximity to where children are. We haven't found that in our case to be situations in which temporary shelters and safe havens have been detrimental to places where children gather. It's usually just folks that are pretty vulnerable that are trying to get their life together. And I appreciate the concerns that other folks have raised about this particular block and some of the challenges it may offer. And I would encourage us to circle back with the provider so they can really directly address and answer those concerns.
All right, if I could just have one follow-up. Mr. Cox, you had mentioned that it would be richly staffed, which I take to mean that there would be a lot of staff there. How do you address the concern that the certificate of occupancy on the ground floor, which is the only common space in that building, is limited to 30 people? If you're going to have a richly operated staff, you're going to have a lot of staff and a lot of services and 70 men, and a lobby that only can hold 30 people. How does that work?
Well, I think the provider will be able to speak a lot more to it, but I think their job is to figure out how it will work. And it's a 24-hour site, and there's going to be a lot of different services offered at a lot of different times in a lot of different ways with the individuals. So I think that is sort of the goal of this model is how flexible it is and how they work with people. And they work with a lot of people in a lot of different ways. So, I mean, I think they can speak a lot more to how they will use the space and in concrete details. But I hear your concern. I mean, it is.
And Shane, let me just add one thing on top of that. So the stabilization bed is an emergency, which we're using, which is obviously a temporary. For the more permanent site, before we can open that up, we have to go through a series of approvals, including there has to be a fair share that's conducted. There has to be an environmental impact, an environmental assessment. We're going to enter a formal contract with the provider. So there are a series of steps that have to go through, that the city has to go through before the final decision is made for this to be a permanent shelter at this location or a permanent safe haven. I want to be clear about that because it's opening as stabilization beds. And then for the permanent, more permanent site that's going to open, there are these other processes that have to take place. So it's not a fait accompli, so to speak, if I said that word correctly.
Okay, thank you.
All right. Okay, Karen's hand is no longer raised, so Susan, you can speak and you are the last. Oh, you need to unmute yourself, Susan.
May, Karen put her hand back up. I don't know if she wants to speak after Susan or if you're allowing it.
Susan, just go ahead, and Karen is the last.
Thank you. First, I want to clarify based on the last conversations with both DHS and with May. So the next Human Services Committee meeting will be the first Thursday in February, and this will be on the agenda again. And there will not be any permanent plans for the safe haven, which I think would be impossible anyway. But there won't be any permanent plans before that meeting in Thursday, so we could ask questions and things could be addressed. Is that correct?
We are happy to come back the first Thursday in February.
And May, that's okay with you?
Yeah, sure.
Okay, so I just wanted to let everyone know that. I got to tell Mike, I do appreciate his comment about we require floor plans from bars. I did appreciate that. I want to ask, aside from this hotel, there are many hotels in CB3 that I think are probably pretty empty. I know DHS does seek out locations. I know DHS does seek out providers. And I would like to know, because the truth is, regardless of this place, we need lots more safe havens. Are you looking at any of the other hotels? And are you trying to recruit any of our local providers? Because I do want to say, if someone came here and said, Henry Street's going to be a provider who is someone we, know and love and has many shelters, I think you would also be getting a different
So we are in a kind of business in which folks have to want to be able to work with us and do that business. So of course, we're always happy to work with Henry Street Settlement. They just would have to want to actually do the work and open it. But that door is always open. We think they're a terrific partner. And if there are specific sites that you think people would be interested in working with us more, please, send them our way. The city doesn't call up and solicit these kinds of sites and locations, but we have obviously a very much of an open door policy in terms of folks finding us if they're interested.
You tried with Rivington House. You did, because Steve Banks confirmed it to me. So I'm just going to say that I'm hoping maybe our elected officials that we could get help reaching out to hotels that maybe in a less crowded area. I think probably most of them are in a less crowded area, but it just seems like there's an opportunity going to waste.
Okay, thank you. Karen Jackson?
Hi, yes, thank you for taking my question. I have two questions and I'll keep it very quick. I live directly next door to this location with a young daughter, so security is obviously a big concern for me. Has there been, like, to anyone's knowledge, has there been any talk of collaboration with the local precinct or with the community affairs?
There have been. They've already met with the local precinct. Am I being muted? No, they've met with the local precinct, the NCO. I know that for a fact that the provider did do that.
Okay, and I assume when the provider comes next month, they'll be able to give more information on what security will look like, correct?
Yes.
Great, thank you. How about a timeline for this? Is there any like proposed opening date at this time?
At this time, my understanding is that well, I think that we've made a commitment to obviously, come back before the board before it opens up. And so that's something where I don't know what the first Thursday of the February is, but clearly that's the 4th. So obviously no sooner than, we wouldn't open before February 4th for sure.
Okay.
Well, in your contract, do they have a start date on this or
it's when there's not a contract when it's stabilization bed, so it's a little bit of a different setup. So the contract is for the permanent site. Stabilization beds are more of a kind of a per diem situation.
Oh, okay. All right. Okay. Well, thank you very much. And we will have this agenda item again next February.
Okay. All right. Thank you.
This coming February in a few weeks.
Okay. All right.
All right. Okay. Thank you.
Bye-bye.
Okay. Bye-bye.
Thank you.
Okay. Next agenda item is this parent resource fair planning. Is Naomi here? I don't see her. Hey, Tati, do you know if she's coming? I sent her an email to remind, but it was only today.
I didn't hear anything from her, but let me send her a quick text and see if she can hop on.
Okay. Yeah, so we're planning for the resource. Oh, it's 8:39. We're planning for the resource parent, the parent resource. If she doesn't, we can talk a little bit and then also, I guess, do it more next month as well. Is Shirley here?
Yes, I'm here.
Oh, okay. Yeah, we're just seeing that Naomi is not in the meeting right now. And Tati is sending her a text to see where she is.
Yeah, I just sent her a message, but I don't know if she'll hop on. So.
Okay. So what do we want to do with this, guys? Do we want to do a little discussion on this, or do we wish to wait till Naomi can come to the meeting? I don't know if she's coming, right?
She just let me know that she can't attend.
She can?
She can't.
Oh, cannot. Okay.
I would opt for tabling it so that we can have the full discussion with her here, and rather than just repeating stuff next month that we would end up having to say again. So.
Okay.
I absolutely agree.
And
yeah.
I'll reach out to the D75 CEC person again, just because a lot of concerns have come up.
New concerns, right? Well, there's always new concerns, right?
Well, right. So, but I think it would be great to include Naomi.
Oh, so you want?
Yeah, I think it's important that we're in collaboration, because I think she'll be able to inform us around sort of new developments, new thinking, some of the shifts in how education is changing, new needs that are surfacing. So I think it would be important to have this discussion with CEC1. That's just my feeling.
I'm sorry, you meant that we should invite the citywide council for D75?
Not necessarily. I mean, I think we're good with Naomi. If she wants to come as well, that would be great. But I think, you know, just in light of some of the previous discussions we've had and thinking about what are our needs, I think it's important to include the CEC. Because
okay.
the ears on the ground, kind of.
Oh, okay. So your thing is, okay, wait till Naomi can come next month.
Absolutely.
Okay, so Tati, you can reply back to her right now. The meeting is the first Thursday in February, but we'll follow up with her on email.
Okay, will do. And I think it would be great if we could have the reps that we had at our last meeting to join the conversation as well, maybe, if people think that would be helpful.
I agree.
Okay, the two reps from the two citywide councils.
Yeah.
Okay, we can invite them. Okay, so we already have 2 agenda items for next month's meeting. Okay, and any other reports from CABs or CECs? Meetings, did you have any meetings since our meeting in January?
Hi, May.
Yes.
Larissa, I did attend the Gouverneur CAB this month. I came a little late, so if Eric is still on and he can add to it, it would really be helpful. The majority of the meeting we spent speaking about the vaccine and the amount of vaccines that the hospital has available, also the PPE. So basically right now, the state provided Gouverneur with the Moderna vaccine. They have distributed the first dose to all of their staff and to all of the nursing home residents. They will have enough to do the second round, and they are planning on sharing their extra doses with local hospitals and other community organizations that could use the extra doses. They also are maintaining a sufficient supply of PPE. I believe, I think it's supposed to be a 90-day supply. I will have to look at my notes again. I'm sorry, but they do have sufficient supplies of PPE and then some to supply their entire staff and their residents as well.
Okay, wonderful.
Hey, can I
Yes,
just ask?
David.
I'm curious.
Sure.
Did they get 100% uptake on their, in their staff and their residents? You had said that they were all.
For staff, you mean uptick in cases you're talking about?
Yeah, no. People who took the vaccine. I'm curious if you know, did all of them agree?
That question did not come up. I'm
Okay.
sorry, but I can ask that during the next meeting happily, because that is a great question.
I'm just curious. I'm curious. It's neither here nor there. Thanks.
But it's good to know, like, how many people are taking it. Are there concerns? I can actually speak to Dr. Gagliardi about that. So I can get back to you on that one.
Okay. Any other questions about these reports?
I have a question that's not about any of these reports. It's about, I can wait. It's just a really quick question.
Well, if no one else has any other questions about the report, and I don't see it.
I have a question I actually want to ask Larissa too about Gouverneurs. I've heard from my health contacts that the people in the clinical realm, there's a preference for the Pfizer vaccine versus the Moderna, because Pfizer is more of an established company, even though the Pfizer one actually has more reactions as reported in the news. I'm just wondering if you can just ask somebody anecdotally. I don't need scientific. I'm just curious if that's actually the case, because Pfizer's a more established company versus Moderna.
So I'm sorry, the question is, did they have a preference?
If they, because I'm hearing from clinicians that if they were the ones getting the vaccine, even though you're not supposed to get a choice, that the preference was to get the Pfizer one because they're a more established company. But they're even in converse to the reports that the Pfizer vaccine, people seem to have more reactions to it.
Gotcha.
That the clinicians themselves as a clinician prefer it over the Moderna because it's just a more established company.
I will definitely ask that question, and I can actually email you an answer.
Great, thank you.
Okay, great. Deborah, what was your question?
Thanks. This goes back, I mean, it feels like 600 years since we went into the pandemic in March, but I'm just curious, the 45 Rivington House is covered in scaffolding right now, completely surrounded. And I know that when the Brads would come and do their reports to us, they talked about sort of keeping the community in the loop about what was happening and things that were going on. So I'm curious, I know they also talked about having, we thought about, maybe I'm making this up, but there was to be a community advisory board. So what's happening? Are we still in touch? Have they reached out? What's going on? Timeline? I know that everybody's focused on the pandemic. I get that. But there is clearly a significant amount of work and clearly a significant amount of construction that's happening there. So what have we heard? How are they keeping the community engaged? And that's my question. Thank you.
Susan, are you raising your hand?
To answer, yeah, to respond to it.
Oh, yeah, go ahead.
So I've never heard of a community advisory board for construction. What has happened for major construction is like quarterly meetings or something like that. I think we did ask them to do an outreach newsletter, which is very common, to go to the residents to say, this is what we expect to happen in the next 2 weeks. If that's not happening, I can certainly check up on that to ask what's happening. Usually construction complaints, if there's problems, that's what comes to, they come to the community board. I actually haven't gotten a single question or problem, on noise, dust, or anything. So are there problems?
No, I'm just trying to ask them to be accountable to the thing that they said that they were going to do. So before you speak, let me finish.
Yeah.
I'm not saying I'm looking for a community advisory board for construction. They promised that they would be in communication with everybody in the community every step of the way. And that's great. And they haven't been. So I'm just checking in, like, what's happening?
So I think they have come to the meetings that Pat, your office calls. What do you call those meetings around Sarah Delano Rosendahl Park, where we have MTA and Mount Sinai Beth Israel? Are you there, Pat?
Yes, I'm here. I'm here, yeah.
So what do we call those meetings that Beth Israel always comes to?
Well, there are two meetings. There's an SDR Park Ops meeting, which has not happened since October or September. And we recently did have a quarterly meeting with Mount Sinai and MTA. That's the MTA fan plant meeting.
Right. Yeah, so I don't think they come to the SDR operations.
Sorry,
I
I don't know
remember
what's
going
happening
to the
technically. I
SDR Park
can't
Ops
hear.
meetings and Mount Sinai was there.
I think we need everybody to mute so that I can speak.
Pat, can you mute, please?
Oh my, there is a very big echo.
Yep. I'm gonna mute.
Okay, I think when Pat muted that, it went everything. So I don't believe they've been invited to the SDR operations meetings, but it's certainly an extremely good idea and a perfect place to have them. They do come and give updates to the quarterly fan plant meetings that Margaret's office calls. And I will inquire about the newsletter. I think there is one. I lose track of them because there's so many, but I think there is one. And I'll make sure that you can get your name on it. And I think as far as the Community Advisory Board, I agree that they did. I do remember that they did say they would be doing that, but I assume that's for the actual, when they actually open, you know, that's that.
No, they said that they would do it before they open, that they would engage the community and be in conversation with us, not waiting until they open. So
Okay.
I'm just.
And I can understand that. I think what we're talking about is like before they open, as opposed to during this long construction period where I don't know, but maybe we want to have them, you know, come to the, I mean, we wouldn't want to come to this committee to discuss construction, but there might be other things that you might want to have them.
Yeah, I'd be curious. I know that a lot of the things that they talked about were in their plan, and how closely are they aligned right now, given where they are in construction, given where they are with the pandemic, given where they are with everything that has sort of shifted in the world, how closely are they aligned to the plans that they presented to the board?
So May, you're muted.
You're talking about the whole hospital plan or just the 45 Rivington Street plan?
Well, if you're going to have them come, you might as well have them talk about everything, right?
Right. I would say both.
Well, the other thing is we should remember. So they're reconsidering their plan.
Right.
So that's that
What?
issue too.
What's
Remember, they're reconsidering their plan.
Who? Which plan?
The
Mount
hospital on
Sinai
14th
Beth Israel,
Street.
the whole hospital plan.
Because maybe it needs to be bigger now.
We talked about that a few meetings ago. Do you
Right.
remember, Deborah?
No, I don't. I might not have been here, so I was out a couple of meetings. So be nice to know there.
Yeah, they figured it after the pandemic. They kind of like said, oh, we need to reconsider like everything, including whether or not they should even move out of where they are now.
David was the one who pointed out, what do we do if there is a situation similar to what we're facing right now, if they're downsizing and there's a pandemic? So
it was in our resolution.
Cool.
So anyway, so it's like we told them so. But anyway, so we can. So they went to the Manhattan Borough President like task force to announce that they were reconsidering, and that was in October. So we did send a follow-up letter to the borough president, to Gail's office, to say, you know, we really are eagerly awaiting to hear this reconsidered plan, and we want them to come to. We'd like them to come to a CB3 meeting, but we did that, you know, to Gail's office because they, you know, are, you know, running, coordinating the task force.
I'm perfectly happy to ask them to come if you tell me when you would like them to come. I don't know if you next month, if you're going to have the whole crowd again with the safe haven, not a shelter.
Yeah, I don't want to combine it with that because that's going to be long, I think.
Maybe March.
Yeah. How does March sound? Okay, March. All right, so that's for March. Okay, I see no other questions. Okay, so we are going to start to adjourn the meeting. I'm making a motion to adjourn the meeting, and we are adjourning the meeting, and we are having roll call.
Second that motion, May.
Okay.
Excellent. Let's take it home, everybody. May.
Yes, here.
Larissa.
Here.
David.
Here.
Eric.
Yes.
Shirley.
Here.
Deborah.
Here.
Tatiana.
Yes, here.
Paul.
Here. Yeah.
Heidi.
Here.
Ricky.
Here.
And Carmen.
Yes.
Okay, thank you.
Okay, so the meeting is adjourned.
Have a
Okay,
great evening,
goodbye,
everybody.
everyone.
Nice meeting
Happy
everyone.
New Year,
Okay,
everyone.
nice.
Happy New
Happy New Year. Stay safe and stay healthy.
Yes.
Happy New Year. Good night, everyone.
Good night.